Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. I'm joined this morning by Don Halcott and Dr. Rebecca Brightman. They're joining us here on the program to talk about IMVEXXY and the Long May She Reign campaign aimed at women over the age of 50. Welcome to Health Professional Radio, both Don Halcott and Dr. Rebecca Brightman. Thank you both for taking the time this morning.
Thank you.
Thank you.
Don Halkuff, if you would give our listeners a bit of insight into your area of expertise, then let us know what it is you do and where it is that you do it.
Thanks, Neil. So I am the Chief Commercial Officer at TherapeuticsMD. The company is based in Boca Raton, Florida. And essentially what Chief Commercial Officer means is I lead the teams that drive the strategy, the planning, and the overall business, including marketing, who developed this campaign we're talking about today.
And Dr. Brightman.
Sure. So I'm an assistant professor of OBGYN and reproductive sciences at the Icahn School of Medicine at Mount Sinai. And I'm a gynecologist in private practice in New York City. I've been in private practice since 1990. And while I take care of women of all ages, I have a particular area of interest in care of women and management of perimenopause and menopause.
I mentioned that we were going to talk about IMVEXXY and a new campaign, the Long May She Reign campaign. Don, if you would give us some insight into IMVEXXY.
Sure. So IMVEXXY is the first product that we launched at TherapeuticsMD, and it's a product that treats painful sex. And I can have Dr. Brightman go into the specifics, but it's a product that treats painful sex during menopause, which is such a stigma in a woman's life still, and brings awareness to the condition of painful sex.
Dr. Brightman, when it comes to painful sex, are we talking only in menopause, or are we talking painful sex that has nothing to do with menopause?
So there are many causes of painful sex, but it affects 1 in 2 women who are postmenopausal. And, the purpose of this campaign is to really increase awareness so that women really feel comfortable and can address these issues with their healthcare provider, because so many women are affected after menopause.
What are some of the causes of painful sex due to menopause?
So, it's interesting. With menopause, so many people think about night sweats, hot flashes, sometimes irritability, but many women are not aware that there are also significant vaginal changes. And with the lack of estrogen after menopause, there tends to be thinning of vaginal tissues, loss of vaginal elasticity, some narrowing of the vaginal canal. And as a result, many women have discomfort during intercourse. And they don't necessarily realize it's a result of menopause. There also can be tearing of vaginal tissues, itching and burning, and all of these things do link back to menopause.
Why is it so difficult to talk to your physician? Physicians are readily aware of these changes. Why is it that so many women, especially with so many affected, are not having certain conversations with their healthcare provider?
So sex is always an awkward discussion for patients, and I think for doctors too. And unless a physician is really comfortable with it and is really dealing with this population, it may not be the first question on a doc's mind, and it may not be something a woman actually wants to bring up with her physician. And I think the awkwardness of it all, and again, the purpose of, today is really to discuss the campaign aimed at empowering women and letting women know it's okay to talk about this. And as a physician, I love it when patients raise concerns, because so many times we are focusing on a certain set of symptoms, and it's important to realize that this is part of the discussion.
The Long May She Reign campaign, how involved does that campaign get with asking the right questions?
Yeah, and this is Dawn, and I'll just add to what Dr. Brightman was saying. It's not that physicians don't have a willingness to discuss it, but part of what goes on is that women realize hot flashes are associated with menopause, but they don't realize that symptoms such as painful sex may happen as well. So part of it is they're just unaware it's related to menopause. So the Long May She Reign campaign is really about, one, bringing awareness that this is something that occurs during menopause, that it's normal, 1 in 2 women, but also empower them, shake them out of their apathy to actually speak to their doctor, speak to a healthcare provider about the symptoms they're experiencing, because she should be taking care of her whole self during this age.
Let's say a woman asks all the right questions and there's still a misdiagnosis. Is that something that is common?
Usually not, if the physician is well versed in the area of menopausal medicine. But I will tell you, it is not unusual for a woman to attribute itching and burning to something like a yeast infection, for example. So it's important for women in this age group to be aware of, something called VVA, vulvovaginal atrophy. These are the changes to the vagina and the vulva that occur after menopause, and they are due to lack of estrogen. And this can be treated. And the treatment using local vaginal estrogen gets to the root cause of this issue. So I think by increasing awareness, women will drive the conversation and they will be empowered to do so.
Although aimed at women over 50, how does the Long May She Reign campaign speak to physicians to get them more aware and to be more willing to listen?
Maybe I'll start there, which is I always say that healthcare professionals are people too, and they watch the same advertising that consumers watch, that women watch, and so a part of it is that they will be able to see this campaign. And I'll tell you, we get, and Dr. Brightman can probably add to this, we get a lot of our healthcare providers that we speak with calling and thanking us for the campaign because it is clear about what to ask for, and they love the way that women in this age are portrayed, which is powerful.
What kind of feedback have you received from women who are participating in the Long May She Reign campaign?
All the feedback we receive is very positive. It reminds people of the show that was out there this past year, Bridgerton, and so they love the fact that it is it's romantic in nature, and that they're showing women as queen, and also talking about menopausal symptoms, not something to be shy about. So we've gotten incredibly positive feedback.
Doctor, briefly, if you could describe how IMVEXXY works to alleviate some of these symptoms.
So IMVEXXY contains estradiol, which is estrogen that's identical molecularly to what the body typically makes, and it's a small little vaginal insert. It's diamond-shaped, for example, teardrop-shaped, and it has a gelatin capsule with some coconut oil and some estrogen, that's suspended in this oil. And it's an insert. It doesn't require an applicator. It comes in 2 doses, 10 micrograms and 4. And 4 is the lowest dose that's available on the market, and it is effective. And when using IMVEXXY properly, women can start to see improvement in their symptoms as early as 2 weeks. So it's a great product. It is, not messy. It can be inserted any time of day. And it's, again, no inserter, which is a big deal for many women who have, environmental concerns and are concerned about something that's going to be neat and something that they can easily, carry with them.
And what about some of the side effects, doctor, or some of the risk factors?
So women who are using vaginal estrogen should discuss its use with their healthcare providers and make sure there aren't any contraindications such as estrogen-dependent cancers. One needs to look at one's personal history, clotting history, and whether or not, estrogen may be contraindicated for them. The most common side effect in IMVEXXY groups when studied are headache. Some women have breast tenderness. And again, IMVEXXY is an estrogen. Estrogens have been noted to be associated with potential increased risk for clotting, breast cancer, cardiovascular disease. So again, this product, like any estrogen, has to be labeled as such, and its use should be discussed with one's healthcare provider before starting therapy.
Well, I really appreciate both of you joining us here. Give us a website where we can learn more about IMVEXXY and about the Long May She Reign campaign as well.
Sure. So if you go to IMVEXXY.com, you will see the video. And if healthcare professionals want to learn more about IMVEXXY in more detail, we also have IMVEXXYHCP.com. So I would encourage people to go there. IMVEXXY is a fantastic product, and we're proud of this campaign.
And the Long May She Reign campaign, does it have a website as well? Or is
it's right on IMVEXXY.com.
Great. All right. Well, I thank you, Don Halcott, Chief Commercial Officer at TherapeuticsMD, and Dr. Rebecca Brightman, Assistant Clinical Professor of Obstetrics and Gynecology and Reproductive Science at the Icahn School of Medicine at Mount Sinai. Thank you both for joining us here on Health Professional Radio.
Thank you.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.